You know, like high five mics.
Yeah. Cheers.
Well, hello everyone. Dr. Fortes here, and we're doing another podcast of Behind
The scenes.
the Scenes. Behind the Scalpel is the name of the podcast, but this is in front of the scenes, not behind the scenes.
We'll have some behind the scenes for you, though.
Right. And I have with me today my
Moon.
guest, Moonflower.
Moonflower, but everybody calls me Moon for short. You may see me around the med spa. I'm one of the med spa coordinators. I'm based out of Post Oak, so come see me when you're by the Post Oak location.
All right. Well, I was going to ask you the first question, which is Moonflower.
Yes.
What's the origin?
Hispanic.
Really?
Yes. Well, I'm Hispanic. The name Moonflower came from a record from Santana. And when my dad and my mom were pregnant with me, they said they didn't want to know. But my dad said, if I have a girl, I want to name her Moonflower. So when I popped out.
After the song.
After the
Okay.
record of Santana, Moonflower.
You know, I had never asked you that before. And how long have we known each other?
8.5 years.
8.5 years. Now I know you're named after a Santana record.
That's right.
Wow. That's very
my dad,
cool.
When I was younger, I hated my name, and he's like, one day, not now, but one day you will love your name. And he was right. Many years later, after high school, after my 20s.
Are you the only Moonflower you know?
That I know of, yes.
Okay.
Besides the record.
That was the first.
Yes.
The first Moonflower.
Yes.
Well, so you've been at ACPS for 8 years?
8.5 years.
How did you get to ACPS? What did you do before?
I actually was in something completely different. I was in, I've always done personal assisting. So I was a personal assistant to my ex-boss that owned properties in the Galleria area. So I helped him with all of that every day, Monday through Friday, helping him with vendors, contractors, payroll, everything.
Okay. So you were in customer service
Customer
of
service.
some sort, which is what we do at ACPS.
Yes,
Customer
I
service.
love customer service.
Yeah, me too. When you provide a service and the customers are happy, then
Everybody's happy.
we've done our job.
Absolutely.
And now you are in a position of management in the spa.
No, so more a med spa coordinator. So I help
Okay.
all of the med spa staff at the Post Oak location. I help them see patients, build quotes, give customer care, customer instructions. I mean, I try to make sure the patients have a smooth ride after their surgery. A lot of patients don't know what to do after surgery. What's the next step? So we make suggestions if they've had a facelift, if they've had work done on the body to make sure that they're going towards the right direction. And most of all, making sure they're taking care of their skin.
Okay. Fantastic.
Yep.
Well, now you take care of patients,
Yes.
but you also have been a patient.
Yes, I had talked about Dr. Fortes since, I don't know, I just crushed on his surgery so much that I was like, one day you are going to do my surgery. And then we started talking about it, and it was time to do my eyes, which you may think maybe I'm a little young, but it's hereditary. My mom had 2 upper blephs by the time she was 60. I think she had her first one in her late 40s, and I'm 44 now. And she had her second one just recently, maybe like 3 years ago. So, yeah.
So what you saw on the upper eyelid
Was
came from
heaviness.
mom.
Yeah, from my mom.
Okay.
She's had an upper and lower, and then she had another upper. But
So maybe this was something that had been on your radar and in your mind for some time before you decided to move on it?
yes, because at a young age I started using eye cream. At that time, Clinique, Lancome, but I always knew my eyes would be a problem.
Yeah.
My dad had dark circles, and then my mom had the bag, so I would always try to take care of my eyes, just to prolong having to do anything and to avoid like getting crow's feet and also maybe prolonging surgery.
Yeah, genetics is inevitable, isn't it? So
is
we see our
inevitable.
parents and we see where they are. They're the generation ahead of our generation. So we
course.
kind of know where we're heading.
Absolutely.
And so you saw that.
I saw that, and I knew at some point that was going to be me. So I was like, we need to take care of that.
All right. So how did you decide the timing to do it? I know that you had done some other procedures before moving forward
Right.
Because you and I talked about the eyes, but we talked about
We
the
talked
neck
about neck,
too, right?
yes. So my mom, she also has, as she aged, her neck just got loose skin, and I noticed that I was starting to get that as well. And I was using good neck and décolleté cream, but I mean, it can only do so much. Again, with it being hereditary, I wanted to start taking care of it so that maybe prolonging a facelift in the future, just buying myself time. And again, people might say, oh, you're too young to think about that. But, I like to take care of my skin. I like to get regular Diamond Glow facials. I like to use good skincare. I mean, I'm 44 and I want to, keep my skin healthy and happy.
Right. It's interesting because I think that there's a little bit of a misunderstanding about when is the perfect
Right time.
time to do procedures to rejuvenate our faces. And some people may believe, well, I need to wait until I'm in my late 60s and 70s to get started. Probably a
It's
little
never, yeah,
late.
it's a little late because you're trying to catch up with father time. So I always tell patients it's never too young to start taking a look, having a good consultation with an esthetician, getting good medical grade skincare, which is important, and also taking a look to maybe see preventatively if you need a little Botox between the brows or a little on the forehead. And it can be what they call baby Botox, just starting a little bit at a time so that when you get to 40 or 50, these lines are so pronounced that there's really not much that we can do. If you're taking care of your skin at a young age, making sure you're wearing good medical grade skincare and SPF will take care of your skin, and you can pull it out to maybe at 40 or 50, and maybe you won't need a facelift at that time.
There's always a transition that happens between late 30s and early 40s where the signs of aging begin to appear. You noticed for yourself. And so somewhere in the decade of the 40s and 50s is probably the great time to think about doing procedures, if not
Earlier.
full-on surgery.
Yeah, absolutely.
And so you decided to do a surgical procedure. Tell us about what you had done and how it
Absolutely.
went.
So I just started to notice that my eyelids were getting very heavy. And even though if I wasn't tired, I felt tired because they were so heavy. And sometimes I would just stop and I would lift them up and I would feel this relief. And I thought to myself, that is so weird. So I had Dr. Fortes take a look and he's like, it's time. He's like, for us to do some, do some upper bluff conservatively for your age. We don't want to overdo it. And we don't want to take too much skin, but let's just help you look more refreshed, which is what I was looking for. And then we did discuss the neck. I just started to notice that I needed there was fat there that honestly just needed to be taken out. And so he was able to sculpt this area the way that I wanted and take the fat out. And just with that, even I will say, I didn't even tell my husband that I was going to do the procedure until the morning of. And I told him, don't worry, my mom's going to pick me up. Everything's fine. After I healed, my husband didn't think I needed anything, but after I healed, I remember the first thing he told me in Spanish.
All spouses say that.
Yes. And he was like, oh my gosh. He's like, I can see your eyes now. And I was like, so I said,
Wow.
you see it? And he's like, I see it now,
know.
and I mean, I could see it in my pictures.
But you had the procedure done in the office under local anesthesia.
That's right.
So you were awake
I was.
for it. How did that go?
Honestly, it wasn't bad at all. I'm not the type of person that likes to go down the rabbit hole looking at things on YouTube, and I think that's what a lot of patients
Probably
will
great
do.
advice.
Yes, don't do it, because if you do, you start seeing different things and reading different things, and it's going to discourage you. Find a board certified plastic surgeon. In Dr. Fortes' case, he's a double board certified plastic surgeon. Find somebody that you can trust. If it's not our doctors that's in the US, make sure that you are doing your research on your
Yes.
doctor.
Very important.
Yes, your research on your doctor. I know that Dr. Fortes has a lot of experience with the face and the upper bluffs and the anatomy of the face and what looks good, what doesn't, and he's very honest, which I appreciate that. Really, it was just not as bad as I thought it was going to be. Like I said, I didn't watch any videos. I went in very comfortable. They gave me something to relax me,
Right.
which I didn't want to take, but they suggested it. And I said, okay, why not,
Right.
since I have a ride home. And it just helped me just take the edge off. And before I knew it, we were numbing and we were getting started. And I was very relaxed. I hope they get to show the video, because we do have a video.
Oh,
And
I'm sure we will.
You'll see me smiling in the video because I was so excited to have it done. But I mean, my pain level was not bad at all.
You had local anesthesia, and I think, did you have a Valium too? Because
I had
that's
a
the other
Valium.
thing. So it kind of took the edge off of the
Mm-hmm. It did.
nervousness. And you probably weren't that nervous to begin with.
I mean, we see a lot of this in the office, and like I said, I didn't watch any videos or ask any. I just wanted to go in and just.
Yeah.
I felt comfortable with Dr. Fortes already, so I knew I was in good hands.
But this is done with no IV sedation. I know
None.
people think, oh, if it's not general anesthesia, then they'll start an IV and I'll get some medications and I'll be out like a light. Not at all. You
No.
weren't. You had the Valium, which is taken by mouth, and it relaxed you, but that was it. And the rest of it was done under local anesthesia. And during the procedure, things were numb and you were comfortable. And
I was.
I remember seeing a smile on your face when we were doing
I
this.
was so excited.
I know.
I mean, I was back at work on a Monday. I did on
Yeah.
a Thursday. I mean, given we can come into work like that, but I was
Right.
able to resume normal activity in the office with
And
no
you
heavy
had
lifting.
and you had some liposuction of the neck too.
Yeah.
How was that part?
Oh, it was great. I had like no bruising at all. I could not believe it.
Good.
My husband didn't even know until he looked up close.
Yeah.
So your technique, the way you do the liposuction is amazing. I, again, didn't feel really anything. I think I felt more the numbing than I did you going in and
Right.
doing the liposuction with the
Right,
cannula.
exactly. Well, it's not a difficult procedure to do. I do them often, both. And I think most patients can do them both and do them with the confidence that they'll be able to do the operation, that it's not going to hurt. I mean, certainly the numbing does hurt a little bit at the beginning, but then once
I would say that was probably like the most painful part, if you want to say.
Yeah.
I mean, opposed to having the eyes done and
Right.
having the procedure done. But after the numbing takes effect, you don't feel anything.
you don't feel anything
You
at
just feel
all.
the pressure, and that's it. But I mean, literally, I was fine. They walked me downstairs, but I was fine to walk by myself, to get into the car by myself. And like I mentioned, I took that pain pill, and I, had some soup, and then I just went to sleep
Yeah.
and just relaxed.
How was the recovery after that?
Not
Because you
bad
went
at all.
home right afterward, and you were awake, walking by yourself. You didn't have to be escorted in a wheelchair.
No, I will. The medical assistant of Dr. Fortes walked me down, opened the car door, but I was fine to do everything by myself. And like I mentioned, like the next morning, I made myself a bagel. Ate as usual.
Right.
But I did have to learn to rest. Your body needs to heal, and so I needed to take 2 days to really just relax. And then after that, I think I was pretty good.
Typically, I tell patients that two important things to do, especially with these sorts of procedures. Head elevation is
Yes.
important, and cooling the face, also very important because they help reduce bruising and swelling.
Yes.
And in the neck, you wore like
Yes,
the
the
thing that looked like a habit, like a nun's habit,
Yes.
and you wore that for about a week.
I wore it for a week, and then mostly at night. Since I was working during the day, I worked for like the first 2 days, and then at night just consistently.
How was it from an appearance standpoint in the first few days?
Not bad at all.
No?
No. The eyes, I mean, you could see the stitching. I mean, but cooling is number one.
Very important.
Yes, and I wasn't doing that. And now I realize why they have the facelift patients wear those cooling masks after.
Right.
Makes so much sense. So once
Right.
I put the cooling on and rested, I mean, big difference from swelling. I mean, I was in elevated, and having the cold compressions and relaxing, it was night and day.
Did your coworkers notice anything about you?
I mean, they noticed the eyes,
Uh-huh.
but it was a great topic piece. Patients love to know what we have done, and they're able to see it up and close. So most of all, I think the curiosity of patients being able to see it and their interest.
So you not only talk the talk, you walk the walk.
Exactly.
So you can tell them from your own personal experience how things go.
Absolutely.
Like you're telling the audience that's watching this podcast
Yes.
how these things go. And they're procedures that are, doable under local anesthesia. That eliminates sort of the grogginess of being put to sleep. And the recovery is pretty quick. I mean, you had it done on a Thursday, and by Monday you were back
back
at
to
the
work.
office. Presumably, I mean, no one drove you to the office. You drove yourself.
To the office. No, yeah, I drove to the office.
When did you see the full improvement?
I saw the improvement on the neck right away. Like when I got home, I think I sent you a picture like on that Sunday
You
or something.
did.
I was like, oh my God, I love it.
You were
And then
like
I was so excited.
beaming because you were, I think you sent me pictures of you like on the beach.
Yes.
And
Well, I was leaving to Mexico like 3 days to Cancun, which is my favorite place to be, 3 months later. And I sent you pictures on the beach. I just was like, oh, I just look so refreshed. I loved it.
I was so happy to see that picture because you look fantastic.
Thank you. I love that picture.
And we can show some examples of your photographs before surgery and then after surgery. Very good.
Yeah.
Well, guys, this is something, if this is something that's of interest to you, Moon's an example of these procedures being done under local anesthesia with quick
Comeback.
recovery and minimal downtime
Absolutely.
of, in your case, less than a week. You're back at the office.
If you're thinking about it, don't think too much. I mean, it's a simple procedure that you can have time to come back to work and not worry about being down for like 2 or 3 weeks. Just come in and see Dr. Fortes, have the consultation, make sure this is the best, fit for you. Also, he'll be completely honest with you, and you're going to love to have seen a board-certified plastic surgeon give you his critique and also let you know what downtime to expect, if you need to start arnica ahead of time, and just take a couple days off. Come in on a Thursday, have it done, go back to work on a Monday.
Right, exactly. Well, if you guys want to see me in a consultation, just call the office and set up an appointment, and I would love to chat with you about it. And if you want to come to the spa where
see
you'll
me.
see Moon and she can tell you about her experiences in
Absolutely.
the spa and the services that are provided in the spa, which are wonderful, and they really complement the surgeries that I perform. Go into the office and check her out, and she can give you a tour
Absolutely.
of the spa services.
I'd love to. Come by and see us. Any questions you have, I'd love to answer them.
All right. Well, I've enjoyed the podcast with you, Moon.
Me too. Thank you for having me.
We'll check with you again after future procedures, right?
Sounds good. I love you.